Hi, this is Dr. Mel from the Center of Wellness. Today we're talking a little bit about cannulas and what makes cannula technique great and some handy tips to make sure that your cannula technique is perfect. First and foremost, and I think the most important out of all of the points, is sterility when it comes to cannulas. Clean, clean, and clean again. When you think you've cleaned enough, clean one more time. Make sure all the makeup is off and make sure that your plane is clear. I think most importantly, of course, is to remember that the cannula often lies slightly to the back of where you're injecting. So make sure that the entire plane is clear, not just the tip of where you're going to inject. So that means the entire back side of the skin where you might be resting the cannula needs to be cleaned as well. Secondly, another part of sterility is that tip of the cannula, that whole portion that could possibly go into the skin, is absolutely sacrosanct. You absolutely cannot touch it. If you have a slight little bit of filler on the tip or maybe a drop of blood, all that you do is you hold the cannula on the syringe and give a nice flick to make sure that any product just simply flies off the end. Please never touch the tip of the cannula to gauze. The gauze is not sterile the minute it's open, even if there is an alcohol or an alcohol swab, for example, even if there's alcohol on the tip. Then let's talk a little bit about actually getting the cannula into the skin. We all know that most cannulas come with an entry needle. Most of mine do. If they don't, just remember that your pilot hole needs to be made slightly bigger than the cannula itself. Otherwise, you're really going to struggle to get the cannula through the skin. Just make sure that when you are using that entry needle to make a hole, that you go just through the dermal layer. The deeper you go, the more likely you are to hit valuable structures underneath the skin. You could hit an artery, a vein, or a nerve. So just make sure you feel that slight pop. The more you do it, the more you'll feel it. There's this pop as you go through the dermal layer, and then you know you're in the subcutaneous layer. And from there, you don't really need to go any deeper with the needle. The cannula itself will make its way. Very importantly, when you are now entering with the cannula, you need to remember what direction you made the hole in. If you've made a vertical hole and you try and put the cannula in and turn it too quickly, it's going to feel like the cannula's stuck. And that's often where most people get stuck and they start to not enjoy cannulas. You've got to remember that if you've put the pilot hole at an angle, you need to put the cannula in at that same angle. If you've made a vertical hole, you need to put the cannula in vertically, just until it's through the dermal layer. Otherwise, it's going to tag and tether, and you're going to feel like you can't advance the cannula. If you're struggling a little bit, just change your direction slightly, and often you'll see it'll just slide in. So that's a really important tip to make your life a whole lot easier. Very interestingly, depending how your other hand holds the cannula or holds the skin is how deep you can guide the cannula. So if you're trying to get your cannula to go deep for a close to the bone treatment, you pinch the skin and then push your cannula through. And by its nature, you're going to burrow a little bit deeper with the cannula. If, however, you'd like to stay really superficial, like with the new age of biostimulators, sometimes it's really important to stretch the skin so that there's a little bit of tension. And as you go through, then trying to flip sideways, it keeps you nice and superficial. The most important thing once you're in is you need to decide how deep or superficial this product has to go. So if you want to go deep, the best way to check is, as you're progressing, lift the tip of the cannula against the tissue, and you'll see if there's a nice mound of flesh over the cannula, then you're deep. If you want to be really superficial, like with the new age of biostimulators, as you lift up that cannula, it's not that you should see the cannula, it should never be that superficial, but you'll actually see the shape of the cannula. It almost like the skin hugs it. So just through visually looking, you'll be able to see how deep you are. When you'd like to change direction with your cannula, so let's say you were here and now you want to go here. You need to remember that the face is not this big, wide open hole. In order to move from there to there, you cannot simply drag the cannula across. You need to almost pull back till the exit point, literally till about 1/2 centimeter away from the entry hole. Change your direction and then progress to the new place that you want to inject. If you find that you're bending cannulas or that they just don't seem to move nicely in the skin, really think about this point. Pull back almost to the point of exit, change direction, and then progress back in as well. One of the most important things to remember with the cannula is that you need help, right? You need an assistant. And often that assistant is not the person standing next to you, it's your non-dominant hand. You really need to think about, this is the one progressing, this is the one feeling where you're going to go. You're feeling, how deep am I? Where is the tip of my cannula? Because in certain situations, like treating a tear trough, you can get really close to the edge of the eye, and that non-dominant helpful hand needs to tell you exactly where you are so that you don't go too far and injure unnecessary structures. Really be aware of where the hole of the cannula is. Just remember, unlike a needle where the hole comes out of the tip, with most cannulas there's a certain distance, maybe 1 to 2 millimeters back from the tip where the hole is situated, and it's on the side. So when you are putting the filler in, you need to almost, for certain fillers, overshoot slightly so that 1 to 2 millimeters progression of where the tip is makes sure that the cannula is squirting the filler out in the right area. And then also just be very aware, is the hole facing down, left, right, or up? Because that also will affect in what direction the filler is extruded. Lastly, of course, cannulas come in many different shapes and sizes. There are different lengths and there are different gauges. The higher or the lower the gauge number, in other words, a 22 gauge cannula is thicker and wider versus a 27 gauge cannula is much finer. The range that's most commonly used in aesthetics, I believe, is between 22 and 25 gauge. So my 3 favorite cannula sizes are 22, 23, and 25. They also come in different lengths, of course. So the longer the cannula, it does take a little bit more skill to use it, but you're able to reach vast amounts of areas of the face through only one hole. The shorter cannulas give you a little bit more control, or the feeling of control. So I often found that when I first started out, choosing a shorter cannula, maybe 40 or 50 millimeters would be fine. In the age of biostimulators now, I find that my favorite cannula of all is a 22 gauge, 70 millimeter long cannula. I know it sounds very long, but you don't have to insert the cannula all the way. Just one word on 27 gauge cannulas. If you have a look at the cannula, it is super fine. It is very sharp. Try touching one that you're not going to use on a patient on the tip of your finger, and you'll actually feel exactly how sharp it is. Just a word of caution regarding a 27 gauge cannula. Most people don't use them anymore, firstly. And secondly, if you are using it, it moves very easily through the tissue, but it can cut just like a needle. So please, be very gentle with the 27 gauge, and perhaps rather defer to a slightly safer 25 gauge cannula. Thank you.